Hello friends, I am Dr. Sunil Madhab Panda, a physician. I am working at present in the Sports Hospital, Bhubaneswar as a consultant in internal medicine. Today, we will know about something about diabetic gastroparesis and its. So let's start. What is diabetic gastroparesis? Diabetic gastroparesis is a common complication of high blood sugar levels, which is characterized by delayed gastric emptying and impaired motility. So when you see the characteristic of a diabetic gastroparesis patient, it affects the movement of food from stomach to small intestine, leading to symptoms like nausea, vomiting, bloating, and early satiety. And individuals with diabetes highest risk for developing diabetic gastroparesis due to nerve damage or neuropathy that affects the muscles of upper gastrointestinal tract, and this can impair digestive function. So poorly controlled diabetic or blood sugar level or long-term hyperglycemic patients, which exacerbates the gastroparetic symptoms. Thus, glycemic control is a crucial aspect in the management of this complication. So when you know about that, once you know about the diabetic gastroparesis patient, how you manage these cases or what are the strategies? First, dietary modification. What dietary modification you need? First, consuming smaller amount of food at more frequent intervals, mostly low fiber diets and fat content diets, and can elevate gastroparetic symptoms. And this low fat and low fiber diets can elevate the gastroparetic symptoms and promote early digestion. So diabetic gastroparesis patients will definitely help from this type of diet. Second most important is the glycemic control. The optimizing blood sugar levels and maintaining a euglycemic state through medications or insulin or lifestyle modification can help in managing this type of symptoms and preventing further complications. If you see some medications, then prokinetic drugs like metoclopramide or domperidone and domperidone are commonly used to alleviate this type of symptoms in diabetic gastroparesis patients. Sometimes there are some resistant cases where you can use some types of toxin like botulinum toxin injection. What happened in diabetic gastroparesis patients, the refractory to the lifestyle modification in spite of good glycemic control, this injection administered directly into the pyloric sphincter, which help to relax the muscles and improve gastric emptying. Now, there are some newer techniques like gastric electrical stimulation, and this involves placement of a device that imparts electrical impulse to the stomach, and it helps to regulate the gastric motility and thus alleviate the symptoms of diabetic gastroparesis. And sometimes you need some treat the psychological aspect, and you need some stress management techniques in along with glycemic control. So, what are the impacts of treatment on quality of life? How this treatment helps the quality of life in these patients? Definitely, effective management of diabetic gastroparesis can significantly improve the quality of life by providing first symptomatic relief and enhancing the nutritional intake. Early identification and interventions are essential for preventing the complications such as malnutrition, dehydration, and exacerbation of diabetic related complications. Diabetic gastroparesis poses unique challenge in diabetic management. So early diagnosis and management are the keys to mitigate the symptoms, preventing complications, and improving patients' overall well-being. So particularly in specialists and healthcare professionals can provide dietary advice, what I told earlier, in the form of low fiber, low fat diet, increased amount of fruits, and along with medications that aid in relieving the symptoms and preventing complications. So advanced treatment sometimes require advanced treatment modalities and tailored therapies can be employed to address the specific needs of patients in diabetic gastroparesis patients. This type of patients are very much unsatisfied with the treatment. They are frequently going to gastroenterologists for doing endoscopy and repeated change of medications of proton pump inhibitors that may lead to psychological disturbance. So even if we treat with medications, psychological aspect like medications to stress relief are very much important for this type of patients. Sometimes we can use newer prokinetic drugs like levosulfide to improve this diabetic gastroparesis patients and improve their lifespan. So patients when patients come with diabetic gastroparesis symptoms like bloating of abdomen, vomiting, pain abdomen. Once you come across this type of patients, please do a ultrasound, upper GI endoscopy, counsel the patient, take proper history so that he can satisfy with the counseling or the first this type of patients have to believe on the physicians because these symptoms are usually have long-term effects and doesn't go with the immediate or one time of medications. They have to come repeatedly and show their physicians so that some medication modification may required in time to time basis and proper counseling is very much important in this type of patients. When diabetic patients with gastroparesis came, this type of patients counseling about food, their habit, their professionalism or their advice for their regular exercises. These are quitting smoking and reduce their alcohol intake also helps these type of patients to improve their symptoms. And overall, this type of symptoms usually go with proper glycemic control. So tight glycemic control sometimes required, but you have to see the complications like hypoglycemia. To avoid hypoglycemia, you have to check the blood sugar regularly. Sometimes this gastroparesis symptom also similarly presents with acid peptic disorder like symptoms like increased acidity, pain abdomen, and in these cases you have to add some proton pump inhibitors or H2 blockers which can take care of their gastric secretion. Sometimes we have come across infection like H. pylori infection in this type of patients along with the gastroparesis and acid peptic disorder. Both we can find out in same patients. So sometimes antibiotics are very much required to relieve the symptoms from H. pylori infection. And as I have discussed, avoiding alcohol, cut down, stopping smoking, increase medications and yoga to stress relief. All these have some effects in controlling both acid peptic and diabetic gastroparesis symptoms.